All right, I hope everyone can hear me and see me well. My name is Jayatma Vikramanayake. I am the UN Secretary General's Envoy on Youth. I'm joining all of you from New York, which is now the epicenter of the world's COVID pandemic. I'm also very excited to be here, be in the company of all of you in solidarity and to talk to all of you and share my experience, your experiences, and experiences of the other panelists who are joining us today. Um, this is a time of great uncertainty and change for many of us. We have been asked to stay at home, keep physically apart, but to remain emotionally and socially connected to help slow the spread of the coronavirus and protect our communities, particularly the most vulnerable among us. So while we are each facing our own individual struggles in coping with this new reality, I cannot stress enough that it is okay not to be okay right now, and that you are not alone in this situation. We are connecting here today to share our thoughts, questions, and worries, as well as our positive experiences to collectively learn, find links, find resources to keep ourselves mentally fit and strong and help our communities and hold our governments accountable to our rights, particularly related to universal health coverage and universally accessible quality health care for all. So today is the first installment of what will be a series of webinars done by my office together with WHO and UNICEF to address mental health among young people in the time of coronavirus all around the world. While this first webinar will be held in English, we are already working on webinars in other languages and focusing on the realities faced in specific regions. So today we will start by hearing the experience of three young people from Taiwan, Iran, and the UK, places which are hard hit by COVID-19. I, together with my colleagues from WHO and UNICEF, then will answer some of the questions that we received from all of you, especially through social media when we were advertising for this webinar. We wanted to have a highly interactive webinar, but unfortunately, we are not able to do this in the first session. We are working hard on ensuring that you can participate as much as possible the next time. So I ask you to please continue sending us your questions on social media, on email. We will be polling them close to the date of the next webinar to gather your views and your needs so we can structure the content and the speakers of the next webinars accordingly. So please look out for these polls and requests for questions and inputs on social media as we go forward. And I really look forward to spending this next hour with you. I hope that you're ready to talk. So, as I said, today we have with us three young people from three countries which have been affected much by the coronavirus. We have Tammy Yu from Taiwan, Ali Amir Khafi from Tehran, Iran, and Lucy Fagin from the UK. So let's hear about their experiences first before we go into the discussion. Tammy, I'm going to come to you first. Thank you so much for connecting with us today. Before I go into my question, how are you? Tell us a little bit about what's your name, what do you do, where are you from, and how are you feeling right now?
Hi everyone. Hi Jay. So my name is Tammy, and I'm a fourth year medical student coming from a very small but very fierce island on the Western Pacific Ocean called Taiwan. And a little bit about me is that I am currently serving as the liaison officer for human rights and peace issues at IFMS, which is International Federation of Medical Students Associations. I am a human rights advocate, and I have been focused on topics such as humanitarian action, especially healthcare and danger issues, migrants and refugees' health, and human rights, democracy, and the rule of law due to my strong interest in the social determinants of health. And right now, I'm doing pretty well. Excited
Thank
for the
you.
webinar.
Thanks so much, Tammy. And Tammy, I heard that in early March, you traveled back to Taipei through Europe, where the pandemic was spreading in several countries, and that you had to undergo a mandatory 2-week quarantine. This is an experience that most of the young people around the world are facing, not just young and old alike. What was your experience like? You were one of the first people in the world to go through this experience. So how did you manage, and what messages do you have for young people who are in self quarantine or self isolation right now as we speak?
Mhm. Thank you for your question. So yes, as you mentioned, due to an IFMSA work-related travel in the end of February, I was notified to be home quarantined when I returned back to Taiwan. So the Taiwanese government now has developed and enforced detailed and prompt policies targeted at travelers and possible contacts of confirmed patients. So I would say that I played my part in Taiwan's very cautious response to COVID-19 as a good citizen. So to be honest, I did feel a bit upset in the beginning because I knew I was going to miss classes and I had more to catch up on studies afterwards. And I also didn't know what I would do at home and how to keep adequate distance with my mom, who was actually living with me. Nevertheless, I had to stick to the regulations and I self-isolated for until my 14-day quarantine period ended. So during this 14-day quarantine period, there were social workers from the government explaining the regulations to me, and my school was checking up on my health, providing me masks and some temperature take equipments. And also my teachers and classmates were very nice to video call me and to keep me engaged in some academic group discussions. So, but also during this time period of we called home quarantine, I also had the time to kind of slow down in life, kind of rewind a bit and reflect on how and what I've been doing for the past months and kind of revise the plans for the upcoming future. So I took the time to actually pass on the lessons, for example, that I have learned in IFMSA, and also remind myself that I need to take more seriously on my exercise habits. And I also modified my schedule according to the current COVID-19 situation. So I think what I learned personally from this quarantine period is that when the world seems to be pausing in the midst of the pandemic, it's actually a very good opportunity to pause your own self, because as we're constantly chasing something, like chasing after something in life, we might be chasing after some academic performances, chasing after social relationships, chasing after maybe your personal like your personal goals, and like in every aspect of life, I think it's like actually a good opportunity to kind of pause these constantly chases, to rewind, reflect, and to refresh. So like I'm very glad that I can contribute to the protection web of Taiwan's response to the pandemic by just simply be a good citizen. And I'm very, very proud of my country to spare no effort to protect the citizens' health and contributing to universal health coverage as well.
Thank you so much, Tammy. I think one of the key things you said was how important it was for you to adhere to the guidelines and advisories
Mm.
of your government, of your health authorities. And this is what I think we've been telling a lot of young people as well. Listen to reliable sources, listen to what your government and the health authorities are saying.
Mhm.
Thank you so much for sharing your experience, and we're so glad to hear you're doing okay. Ali, I'm
Thank
going to
you.
turn to you now. Ali, tell us a little bit about yourself as well and how you're feeling right now. And I hope the situation is in Iran is getting better.
Yes, thank you so much, Jayatma, and hi everyone. I'm Ali Amir Kafi. I'm a fifth year medical student from the capital city of Iran, Tehran, a city which was the heart of the fight against COVID-19 in the past few weeks. And today I'm super excited to be here to tell you my story regarding the effect of COVID-19 on mental health.
Thank you so much, Ali. So, you are a medical student in a country that's been heavily affected by the pandemic. Can you tell us a little bit about how did it start and what was your experience like when it started, and what did you do, and what are your messages for young people who are experiencing the start of this pandemic in their own countries right now?
Mhm. Actually, in Iran, the first cases of COVID-19 were reported on the February 19th. So now we're on the sixth week of this outbreak. Meanwhile, we had about 44,000 cases, about 3,000 deaths, and about 15,000 people have recovered, which is really good. But during this time, how was I feeling? This is an important question. Just like many other young people, I was suddenly in the middle of an outbreak, something that I had no clue how to tackle in real life. And also within 3 days from the start, schools and universities were shut down, the gatherings were canceled. So this was a source of confusion and anxiety. Also, a lot of my friends who were interns and residents at the hospital, they had some sort of a similar situation. They wanted to help the people, but also they were so anxious. One of the main causes of this anxiety was receiving a lot of false information through social media. This some sort of infodemic caused a lot of mental stress on the people and also on the healthcare workers. But during this situation, we didn't just sit and wait. My story has two sides. The first side, as the president of Iranian Medical Student Association, which is a member of IFMSA, I work with the most concerned students in Iran. We provided healthcare workers and also the people with the most reliable information from the ministry and from WHO. And following these reliable sources helped to bring down the level of anxiety and fear considerably. Second, as a medical student myself in the hospital, I was with the angels who worked day and night just to keep their world, just to keep their country healthy once again. In this situation, it was really important to keep everyone happy in the hospital and away from negativity. In those times, everyone was more like a family member than just being a co-worker, living together, laughing together, and it was really important to keep the energy high. Also, it was important to improve the mood of the patients because they were in the fear of their own disease and it was a hard time. So these two sides were the main part of my story in the past few weeks.
Thank you so much, Ali, for sharing that experience. And I think, as you said, a lot of us are going through this anxiety right now with a lot of information coming at us through different channels, especially from social media. And as you said, it's very important, particularly for our mental health, to make sure that we take this information in right amounts and at right times to make sure that we are not overwhelmed ourselves. So thank you so much for sharing that. Next, I'm turning to Lucy Fagin. She's joining us from the UK. Lucy, I heard that you are joining us while you're at work. You're taking some time off to join us. So thank you very much for that sacrifice you're making. And before I jump into your question, tell us a little bit, and the viewers a little bit about what you're doing in the UK and what you're doing right now.
Hi, Jay. Hi, everyone. I hope you can hear me okay.
Yes, we hear you very well. Thank you.
Brilliant. I'm doing well, and I hope everyone's doing the same. So just a little bit about me. So I'm based, living and working in London, which, much like New York, is the epicenter for our outbreak here in the UK. And I'm involved in the national outbreak response here. So I'm working as a public health specialist and a health professional. Originally, when the outbreak started, I was working very much on the clinical aspects. So looking at contact tracing, which I'm sure everyone's heard a lot about over the last few weeks and months, um, and also case management. But increasingly, as we see the implications and the repercussions of this outbreak, really looking at some of the public health impacts, including mental health for the most vulnerable in our community. As you said, I'm still traveling into work most days, despite the country being on lockdown. So I am managing to keep up a little bit of a routine, even when everything else seems quite strange. And then alongside this, I'm also continuing to engage and raise my voice as a youth advocate, working on Health for All. So I'm working with the Commonwealth and the UN Major Group for Children and Youth, because I think, as we've heard from the others who've just shared their stories, the voices of young people are more important now than they've ever been.
Thank you so much, Lucy. Thank you also for the important work you do. When you said you are working as a part of the public health response right now in the UK, what are some of the key issues that young people are facing in your country, and how is the public health system, or you in your capacity, trying to help them? And in this experience, do you have any key messages to young people who are listening us today from all around the world to learn from what's happening in the UK?
Thank you so much. Yes. So while I'm still traveling to work, for many young people, in fact, most young people here in the UK, they're now in lockdown and spending most of their time at home. As you can imagine, this experience is quite different for different young people. So some of them are in self-isolation due to symptoms. Some of them are facing the reality of school and university closures and wondering what will happen now that their exams have been cancelled. Some of us are working from home, but many young people, especially those working in the service sector, have been furloughed or they've lost their jobs. So there are big questions for them about how they pay their rent. And while it seems pretty cool that you don't have to change out of your pajamas until midday if you don't want to, which I think was everyone's initial reaction when they heard they might need to stay at home, I think a lot of young people here are struggling with the loss of routine or sense of control, or actually just anxiety about all the news coming in. And I think this is a big one because there is such a constant stream of information and stories, and some of them are true, but some of them are not true. And it's very, very hard to navigate through that and also just control how much you're hearing about this and what that means for your well-being. Um, and for some of our peers, we know that home isn't always a safe or a secure place. And this is something that is quite concerning. So as young people, we will experience health and well-being challenges during this outbreak that go well beyond the immediate risk of infection from COVID-19. I do think that's important to keep in mind. But those are some of the challenges, and I think I do want to focus on the positives. So in this situation, connecting is so important. We might be socially distancing, physically distancing, whatever we're now calling it, but that doesn't mean that we need any kind of emotional distance. We need that emotional support both for ourselves and to provide to others. And as young people here in the UK, we're adapting really quickly. We're using Skype and WhatsApp and all the other forms of social media that we've already been on, but really making sure that we keep reaching out to people. At a personal level, I'm checking in with my loved ones regularly, especially with my family or my friends, some of whom are struggling with some anxiety or low moods, and we just share a virtual cup of tea, talk about how we're doing, and that's good days and bad days because there are both. And continue just to share our laughs and our stories, which I think is really important. And when we look at how we protect the mental health of young people here in the UK, the public health response is very much about how can we support young people to be resilient during these times and to do the things that bring meaning to their lives and help them continue to have some semblance of normality. Even though many things are strange and different, there is so much we can do to connect and to build that around each other. And I think one of the things I just wanted to really emphasize is that these personal connections are really important for us to prioritize as the wider youth civil society as well. So online as young people, we're exploring new ways to mobilize and learning from each other in this new environment, and understanding really what that means for our advocacy and how we fight for our rights, as you mentioned, Jay, which I think is really important. But one of the things that's come to be really important for us is thinking about how we can also support each other at a personal level. So looking after our own mental health and well-being and also each other's. So I'm involved with the UN Major Group for Children and Youth, and one of the things we're doing is establishing these regular solidarity calls. And the idea behind those is really that young people can come together to reflect on the situation, and to share their thoughts and their feelings in a non-judgmental space, and feel that connection that others may be experiencing the same concerns and worries that they are, even in different contexts and in different environments. And then our members are taking that further and they're running local online mindfulness sessions or connecting to do yoga together or sharing tips for personal resilience and well-being, bringing plants inside, bringing a little bit of the outdoors in, and generally connecting young people in a really human way. And I think that's really important to keep in mind during these times that, our humanity is still incredibly important, and the connections we have with each other will give us that resilience and support to get through it.
Thank you so much, Lucy. That was very important, what you were mentioning. And in the last couple of days and weeks, actually, I've had a lot of young people reach out to me as well with their concerns and with their issues, and some of the things that you said really resonated with what they wanted to share. Especially, most of you all have been looking forward to, your graduations, starting off with your first jobs, or changing your current work into something else, and lots of different milestones which are now all put on hold because of COVID, because of something that is out of our control. And I think, Lucy, as you said, it's very important to remember that you're not alone in this, that all of us had to deal with this issue and cope with this issue in some way, but it's always better when we do it together and when we do it collectively. And I really want to point out what Lucy said, what the youth organizations and youth groups and youth communities around the world are doing. For an example, the Major Group for Children and Youth, Lucy mentioned having these solidarity calls and peacefulness, mindfulness sessions. I saw the United Network of Young Peace Builders doing the same, I think 3 days a week or something in the morning, getting their community together virtually. The Scouts are organizing a virtual jamboree for everyone around the world. So this is also such a great time, I think, to join a youth organization and join a community that resonates with your values, with your priorities and your needs, so that you can be part of that bigger community and tap into those resources, tap into those tools, tap into those platforms that these youth organizations are creating around the world. So use this as an opportunity, I would say, to all the young people who are listening to us, to be a part of a youth organization and a community, where you're from, or virtually from around the world. So as I said earlier, we have about 1,025 young people joining us online. A big hello to all of you joining from all corners of the world. Thank you very much for tuning in. I also see that all of you want to have, a lot of you want to have, a lot of you have questions and you all want to ask them. And I see hands going up virtually. But unfortunately, as I said, at this point, we won't be able to take any questions or conversations with the audience, unfortunately. But for the next session, we are hoping to create a safe space where all of you can come and express your ideas, ask your questions directly from the panelists. But for now, I'm going to go through the questions that we received beforehand from all of you from social media and also directly to us. And to help me answer those questions, we have two experts with us today. I have with me Dr. Tarun Dua. Dr. Tarun is the Chief Mental Health and Psychosocial Support in WHO. And I have Dr. Zainab Hijazi. She is the Technical Lead for Mental Health and Psychosocial Support in UNICEF. So we have two experts here to answer the questions that you have sent to us earlier. Dr. Tarun, I'm going to go to you first, and I would like to ask you this question that one of our followers sent. And they say, in the current situation, I find myself panicking a lot and I'm always exhausted. How can I overcome this feeling? Dr. Tarun, would you like to help our young viewers to answer this question?
Thanks, Jay. I hope you can hear me well.
Very well, yes.
Thanks. So as you mentioned earlier, that the situation that we are in today due to COVID-19 is a stressful situation, and for all of us actually around the world. There is no country that has not been impacted, and nobody who has not been impacted because of COVID-19. And we are seeing that it can impact, for example, as changes in mood, there could be increased irritability, feeling low, difficulty in sleeping, feeling exhausted, and these are different than your usual patterns. The important point to remember is that everybody copes differently. And there are a few things that you can do to help you cope better during these difficult and uncertain times. So for one, I would like to emphasize is that connecting. social connectedness is extremely important. Connect with people you trust, with your friends, your families, and there are so many mechanisms to do that. And as young people, you know them much better than I do. The second point is about that whether you are staying at home because of the national guidelines or working from home or quarantine, what we heard earlier, try to maintain a routine. That's very important. And the lifestyle issues like having a proper diet, sleep, exercise, having a good routine, these are extremely important. Third, try to do some relaxation exercises. Again, there is a lot that's available on internet, for example, on YouTube videos, by apps, meditation, yoga, mindfulness, whatever can help you, try to do that. Fourth, you might be feeling overwhelmed, and it might be important in those cases to talk to a health professional, a social worker, or anybody who's trusted within your community. So get some professional advice if you feel it required. And last point I wanted to emphasize that has been said earlier is that we are bombarded by news 24/7. And so you need to see that the time that you spend looking into news or listening to news is minimized, maybe 1 to twice a day, and then use credible sources for information from your national government or other national guidelines or WHO, UNICEF, or UN. There are many sources providing that information. So these are some of the strategies that are helpful for not only young people, but actually all of us. Thank you, Jay.
Thank you very much, Tarun. I have another question for you, Tarun. This is also a question that we received on social media. I feel like I'm constantly dealing with disappointment. So many things are getting cancelled. I can manage with the smaller everyday things, but then there are big things like my graduation and losing my job. How do I cope with this?
Very important question that the community has brought up, and there are many disappointing events or moments that you must be facing, and I would say it's natural to feel that way, that you would be frustrated by things that are happening around you. The most important thing to do is first to acknowledge your negative emotions and reach out to somebody in your family or in your friends and express in ways that you feel comfortable about. Remember, there are many of these situations are beyond your control, but even then it's very important to talk about them with somebody whom you trust with. And you need to give yourself time to process your emotions. I think that's important, and figure out what steps you need to take. Uh, uh, and as I said earlier, it's okay to talk about your disappointment. After all, many of these events, for example, would have been a big part of your life. But then moving forward, think about balance. These are things that have been frustrating, disappointing, did not happen, have to be put on hold, but there are things that you are grateful for. And then there are other things that you can focus on that can, for example, helping others, checking on your grandparents, helping out friends who might need, and if required, you may need to reach out to a health worker or a social worker or a mental health professional to discuss your emotions. I would like to end with saying is that right now the situation is uncertain. We don't know much about how and when things will be back to normal. But remember, this is the new normal. Currently, things will change. And acknowledge that within this new normal, there are things about basic self-care that I talked about earlier. Good diet, good exercise, good sleeping pattern, and having a good routine.
Thank you so much, Dr. Tarun. I think that will help a lot of us to deal with the current anxiety and uncertainty that we are all facing around the world. The third question, let me try to answer this one. I'm very anxious and having difficulty focusing and getting anything done. How do I adjust to a new routine and keep my motivation? again, this is a frequently asked question from our constituency, from the young people who are trying to deal with this pandemic, both individually and also collectively as communities. And I think the key to this is that we rely on concentration a lot to get through work, to get through our education or school every day. And we usually have timetables in schools or universities. We have in offices, we have a schedule, we have someone who keeps you to that schedule. And when we are unable to concentrate, we can't think clearly or focus on a task or complete our work properly. And the way that I personally have dealt with this is to make lists of the tasks that I would like to complete every day. And so I can keep track of the way I'm doing my work, but also I can stay focused and concentrated because I have specific goals and tasks to be achieved at the end of the day. So first, I consolidate like similar tasks together. So for an example, in one day, I have 8 hours of work. So in the morning, I try to take all my calls, all video conferences, webinars. I try to do them in the morning. And in the afternoon, I try to do the work that needs a lot of writing, the work that needs a lot of thinking, a work that needs planning and organizing, a work that I need to focus for longer hours. I keep them separate. And secondly, I do the things that take only short amount of times and are easy to do immediately first. So when I tick those boxes, I get a sense of accomplishment myself that, oh, in the morning I did all of this. That means I'm up to my productivity level, and that keeps me motivated to get through the rest of the day or the afternoon. And then thirdly, I think it's very important to schedule blocks of time for important things that needs thinking. So even designing what your schedule is like going to need some thinking time, because this is a new routine, a new way of life really, and you need to figure out what your style is and how you want to design your day and how you want to plan your day yourself. So we hardly have this thinking time allocated for us when we are busy with work, 8 to 5, 9 to 5, and trying to get through our tasks daily. But at the beginning, it's very important to allocate that thinking time to plan how your schedule is going to look like. And fourth, it's very important to organize the workspace as far as possible if you're working from home. So trying to create a separate workspace, and also setting it up like a small home office, giving you the feeling that these are your dedicated hours, but this is also your dedicated space to do your work is very important. And usually, if you're living in a small apartment like mine, you'll have to negotiate which times you are on calls, which times you can be loud or not with your partner or with your family members. So it's very important, I feel, to plan and to communicate both with your teams, your office, but also with those who are at home in order for you to have a very productive set of work hours while you're working from home. I also know that some people get up in the morning, shower and dress up like they're going to work. So mentally they can set themselves up for working. But for an example, personally, it doesn't work for me. I like to work in comfortable clothes with no dressing up. So you really have to figure out what your style is and what works best for you, and what doesn't work for you, because it's really based on individual needs and priorities. So allocate that thinking time to think for yourself which model and which routine works best for you. With that, I'm going to go to Dr. Zainab. Dr. Zainab, we have a question that I think you can answer well. The question is, what can I do to help support the mental health of my family and peers?
Thank you, Jayatna. So it's really not uncommon that you know someone in your life that needs some level of mental health and psychosocial support. So you're not alone. Whether it's a friend or a family member, there really are many ways that you can support somebody that you care about that you feel might be struggling. Well, first, the most important thing is to let them know that you are there for them. and available to talk and listen, but of course, only if they feel comfortable talking about what they might be feeling, whether it's worry, fear, and anxiety, or loneliness. Remember that everyone is different and they will feel things in different ways and will want to express those emotions and thoughts differently. Make sure that you find a way, in a kind way, to check in on them regularly, being mindful to learn how long they have been feeling this way and how it might be affecting their day-to-day activities. You need to pay attention to what they're telling you and show that you care in ways that are acceptable and appropriate to the person struggling. You might also find it helpful to learn about some self-care and self-help strategies that you can share with your loved one. Regular physical exercise, or maybe learn about some relaxation exercises like breathing, meditation, mindfulness practices. All of these really might help reduce feelings of anxiety and worry. So it's good to be aware of some of those things that you might be able to share with your loved ones. Of course, before anything, reassure them that it's really natural to experience different and sometimes negative emotions in situations like this. This is not the normal. This is not a normal situation that we are in, rather, and that you are there for them. Do not underestimate really the support that you can provide and the impact that you can have on the person's ability to express themselves and to really work towards being well. But I feel, it's really important to mention here to remember your own role. Yes, you can do a lot, but you cannot do everything. If your loved one is not getting better, if they're getting worse or struggling with their day-to-day functioning, discuss some care options that might be available, including professional help. If you don't know what options are available, you can offer to help them, figure out some of these options together. There are now, in the different places where we live, there are many mental health professionals that are offering their time and volunteering and providing services by phone and by video conferencing, and a lot of these services are available for free. And finally, I must say, you need to really take time for yourself. Even when you're taking care and worrying about others, we really need to take stock of the impact that all of this is really having on our own well-being. So take the time to care for yourself and take the advice that you're giving to others as well.
Thank you very much, Dr. Zainab. And there's another question. I think I'll try to answer this one. Staying at home all day with my family members is challenging, and I'm super irritable all day. How do I keep my mood in check and avoid getting in fights with those I'm living with? So I think we all know, even if we love each other very much, staying at home all day with your family can be challenging at times. And whether you're still living with your parents and siblings or with your own partner or children, here are some practical advice that the UN has put together for you. And the first of it is to establish boundaries and an everyday routine that everyone agrees on. I know that the conversation on establishing a routine, establishing a schedule sounds very cliche because everyone is talking about it right now, but that is really the way to go about it. That is, when you are faced with circumstances, sudden circumstances like this, planning and organizing is the best way to deal with these issues. So it's very important to establish those routines with your own family, but also to establish those boundaries as to who takes which space, or who does what household chore or which task in which part of the house. It's also important that when you make these schedules and make these decisions, that everyone is taken into account. So not just the parents deciding for children or children deciding for themselves, it's really collectively, or everyone in the family, especially the younger ones, are consulted, and that they should be included in making this plan for the whole family, because that is the only way they will feel the ownership, that they should also stick to this routine and they should also stick to this schedule. And this is a joint schedule for everybody, and everybody has to play their part in order for this to be successful. And I think it's also important to acknowledge issues that could create tension, that you foresee creating tension. So for an example, preferred locations for work, or preferred locations to do the homework, or taking turns to watch TV. We know that even on a normal day, I fight with my siblings to watch on TV. So I think it's important, especially in these circumstances, to plan these things, talk about these things way in advance, and to make sure that you can avoid tensions inside the house, because we are all dealing with so many tensions outside of the comfort of our homes right now. And it's also important to acknowledge that it's going to be difficult to avoid any disturbances. So agreeing on when to talk, when to bring up questions, when to discuss is very important. For an example, can some people work with the TV on? Can some people work with the TV on mute? Can some people work while music is playing in the background? So these kind of very small things that might not have mattered before are starting to matter now, and it's important you acknowledge this and have conversations about this with your family. And also don't forget to allocate some time and have some time for yourself, and negotiate for this time with your kids, with your family, with your partner, with your boyfriend, with your girlfriend, with your husband, wife, whoever that you're living with, your roommates, your flatmates. Negotiate some time for you to be alone and to think for yourself, to process your emotions, like Dr. Tarun said. And also, every time you feel stressed and anxious, don't forget to take a few deep breaths before you start reacting. Take some time, pause everything and take some deep breaths, and then try to answer the questions around you. And I think in the last few weeks, a lot of people have also asked questions around excessive use of social media and excessive use of alcohol as coping mechanisms to deal with the anxiety and the overwhelming nature of the issues that we are all facing. Obviously, this is not something positive, and so not something we should take as a coping mechanism. So be careful about what you choose as a coping mechanism, if it's a healthy coping mechanism or not. So I hope that I was able to answer at least some of those questions. And the last question, I'm going to give it to you, Dr. Zainab, to answer. And that is, what are some activities I can do to connect with my friends during quarantine?
Thank you, Jayatma. So it's a good question, and I think this will be very different depending on where you are in the world and the setting that you live in. In most settings where internet is available, contacting friends is easier than ever. Thanks to technology, platforms like WhatsApp, Facebook, Skype, Zoom. They allow us not only to talk to our friends, we can also see them, we can interact, play, and socialize in a way that is meaningful and supportive. We can organize a virtual game or game nights, or even start online book clubs. But it's really important to think about and not forget that for some families, this might not be possible. For example, families in low resource settings, or the families who are living side by side in overcrowded tents in densely populated refugee settlements, where not only is physical distancing unrealistic, it's simply not an option. And similarly, some of these networking options that require internet access to maintain social connectedness might not be an option as well. So think about ways within your communities that can work within your context. Build on what youth and family members might need to feel well, what they communicate might be helpful for them to be able to connect, and try to adapt these in a way that is feasible, but of course, most importantly, in a way that is safe. Remember, it has been mentioned over this webinar that we are being asked to maintain physical distancing, but we really need to work on maintaining social relationships and connections. And this is really core to our well-being.
Thank you very much, Dr. Zainab. And I really want to stress on the part where you spoke about safety. With increasing number of young people spending their time on the internet and on social media, and as you said, using the internet for education and for work, but also to connect with family and friends, they are highly vulnerable. We all are highly vulnerable to also cyber crimes and bullying online. So please always keep in your mind your experience and be very conscious. And the moment you see something, please report or get yourself out of that. I think one of the very practical examples were when we were preparing for this webinar, when we were doing our trial run, we also faced a similar situation where a group of people joined the public link and started sort of using abusive content on the webinar. And that's one of the reasons why we had to close the chat boxes and close the Q&A section and our interaction with all of you to make sure that all of our panelists, all of us, but also all of you as viewers are protected and are safe in this online space that we are creating for each other. So thank you very much for bringing that point as well. So those 6 questions we picked from the mostly asked or frequently asked questions. And now I'm going to wrap up all these discussions in this small PowerPoint presentation that we have prepared. So basically, this is everything that we discussed today, but in a nutshell. So feel free to take screenshots if you need, take notes if you need. And also at the end of the PowerPoint, you will see a slide with resources and contact information if you need to get in touch with us. So let's go to the PPT and self-care reminders. And as I said at the beginning, remember you're not alone. And I know that in a lot of situations when we are anxious, when we are down, when we are scared, when we are feeling insecure, we feel like it's us and there's something wrong with us and that I'm the only person in this situation. But please know that you are not alone, and this is felt all around the world, and everyone in their own way is trying to tackle with this and cope with this. So so please know that you're not alone, and also know that you could react to this reality in a very different way than I do, because different people react in different ways in stressful situations. So also be kind to other people who might not be dealing with this issue the same way you are. And also know that it's okay for you to feel sad, and it's okay for you to be anxious and to be feeling all of these emotions. It's going to take time, as Dr. Tarun said. It's going to take time for you to process these feelings, and there are going to be stages in your life where you are right now processing these different emotions. So in the next couple of weeks, you will go through different types of emotions and be conscious and aware of those emotions. And the best way that I've found, I think many people found, is to being able to talk to people you trust and to be able to share how you're feeling, and also sharing how you can help each other. So the things that you can do to cope with stress is to, even though it doesn't seem like it, one of the best ways to deal with your stress is to take care of your body. So try to eat healthy, well-balanced meals. And I'm guilty of this, because in the first week of quarantine, staying at home, I finished all the chocolates and candies that were in my house, because that was the way I thought I should deal with my stress. So that is not a good tip, and that's not good advice. So try to eat healthy, have some healthy snacks prepared and around you. Exercising regularly is also, I know this is being said many times, but trust me, when you start working on it, you're going to start feeling good. Getting plenty of sleep is also important. Again, this is something that I personally tackled, because on the very first days, because I don't have to go to work the next day, or I don't have a very strict schedule, I ended up going to bed at 2 a.m., 3 a.m., watching news and watching TV. And then the next day I felt completely exhausted and even more stressed. So make sure that you get plenty of sleep. And as I said earlier, try to avoid alcohol, drugs, and negative ways of coping with the current situation. Take time for yourself, time to unwind. try to do some other activities that you enjoy. This could be the time to find a new hobby. This could be the time to read up on something that you always wanted but you never had time. As I said, try to join a youth organization online, try to join an online community on an issue that you care about. There are so many opportunities to volunteer online. So find other activities that you can enjoy, because helping others not only helps the person you're helping, but also it helps yourself, because then you will start feeling like you contribute to something bigger than yourself. And as I said, every time you feel stressed or there is a tension with someone you love or around your house, take deep breaths and process that feeling before you react, and take small breaks throughout the day to stretch, to breathe, and just, as I said, take time to figure out what strategies work best for you as an individual. And don't be stressed to be fully productive during this period, because it's okay for you to be less productive because of all the emotions that are going through your mind. So if you're feeling that way, have a conversation with your teachers, have a conversation with your supervisors at work or your managers to let them know that this is how you are feeling, and that you might not be able to be as productive as you want to. And I'm sure in this point, everyone will understand or try to understand. And as I said, trying to maintaining a routine can help keep all of us grounded. So getting up at the same time, setting tasks for yourself to complete, making sure that you include breaks, leisure activities, time to connect with friends and family, and also designated times to check on news. And again, from personal experience, more than watching and checking for news ad hocly throughout the day, I find my emotions very easy to manage when I check news or social media in specific times throughout the day, and definitely not just before I go to bed. So somewhere in the middle of the day, in the late afternoon, or in the morning, as it works for you, allocate time to check news, and only watch news and social media using those during those times. Tips for coping with extended time with family or housemates is to be aware of the needs of others in the household. So if you are generally a kind person, you'll have to be extra kind during these days, and discuss schedules, spaces, keep some time for you alone, communicate your needs clearly and calmly with other members of the family. And one of the great tools to help you do this is to create a self-care plan. So this is a demo of a person called Ignacio and their self-care plan. So what are you doing to take care of your mind? What are you doing to take care of your body? What are you doing to take care of your spirit? And then who are the people who are supportive for you, to you in your life? And then what do you want to accomplish in your life? And putting this in a diagram like this, either in writing or in your own mind, can help you understand what healthy practices you have right now, what unhealthy practices you have right now, and help you acquire some good healthy practices and give up some unhealthy practices, to make sure that you maintain both your physical and mental health during this time, because these two are definitely very much interconnected. And then if you or someone that you care about feel overwhelmed with emotions like sadness, fears, and worries, a lot of the times, or they feel stress gets in the way of their day-to-day activities, or feel like you want to harm yourself or others, please seek a professional help. Please seek a professional support. I know that around the world there's a lot of stigma in terms of talking about mental health and seeking for professional support, but just know that it's completely okay to talk about your issues, to seek professional help when you need it. So please keep this in mind. In the past couple of weeks, I saw many governments sharing helplines and psychosocial support services to help their citizens deal with these issues. There's also a number of civil society organizations, INGOs, who are running similar services, particularly through the phone or through the internet, to give that professional support you need. So do a quick search and keep those phone numbers and websites and pages in mind, so that you can use them if you need them, but also you can help someone else who needs them by sharing that information. And last but not least, be kind to yourself and try to be as gentle as possible with yourself at this time. And don't set unachievable high expectations for your productivity and the work that you do, because we are all affected, and it's okay to not be as productive as you would be any other day. So be kind to yourself, because that's the starting point to be kind to others. So with that, I think I've summarized most of what was discussed in the webinar today. And before closing, I want to share this small video of what young people are saying around the world on coping with COVID. Do we have the video?
Should be coming on. Just one moment.
Koronavirus je tu, pred vratima je Crne Gore i za kraj nemojte se bojati toga što imate toliko puno vremena koje možete na pametan način iskoristiti. Naprotiv, upravo to treba da shvatite kao dobar čin koji sebe i druge štitite od koronavirusa.
Thank you very much, Jennifer, for playing that video. So as I said, I hope that you got some good insights over this 1 hour as to how to cope with COVID and be mentally strong. I hope our 3 youth speakers and our experts have inspired you and encouraged you to take some very practical steps to organize your life and deal with some of the challenges as we are all in this together right now. So here you will see a slide with some links to resources and information on how to reach us. So please feel free to take a screenshot if you need. Also, if you have any feedback, comments, ideas, or even speakers you think that we should feature in our next webinar, please email them to the last emails you see on the slide, which is my email, youthenvoy@un.org. And also any feedback or comments as to how you think we can improve this webinar series as we move forward. So thank you very much.